My opinion is that it's not significantly overdiagnosed. That said, that one needs to proceed with a lot of caution, as with any diagnosis. But ADHD, for example, in this case, we need to be very careful that we are holding a child to appropriate developmental expectations, right? So especially with younger kids, that's not to say that it may not be an appropriate diagnosis, but you really need to proceed with caution and just cross your T's and dot your I's diagnostically.
Welcome to the ADHD Families Podcast. I'm your host, Sharon, an award-winning credentialed ADHD coach and consultant and mama and wife to a very ADHD family. I am seriously obsessed with making life easier for people with ADHD and those that support them. My business, The Functional Family, provides life-changing support and strategies for ADHD. I particularly love anything that saves time, decreases conflict, and creates space for fun. Do you want a life with your beautiful family that is more functional, fun, and full of joy? Let's explore together the wonderful and sometimes wacky world of family life with ADHD in the mix. Welcome to another episode of the ADHD Families Podcast. I am so happy that you are here. My name is Sharon. I am your host. I'm a certified award-winning ADHD coach and consultant, and I love anything that makes life easier for beautiful families that have ADHD in the family, just like my own. Today, I've got a special interview for you. It's with Dr. Yael Rothman and Katia Fredricksen. And these guys are incredible pediatric neuropsychologists from the States. And this chat has so many great practical tools. We're going to talk about what it is that a neuropsychologist does. We're going to talk about why it's important for our children to learn about their diagnosis. And they're going to share with us their book to help us do just that. We're going to talk about ADHD in girls and how it presents differently to how it presents in boys. We're going to talk about some practical tools on how we can support our beautiful kids and what we can say to that uncle at the barbecue who has strong opinions about ADHD. Let's get to it. Welcome to the podcast, ladies. I'm so excited to have you here.
Thanks for having us.
Thank you so much for having us.
So I'm just going to delve right in. I want to know a little bit about you guys and why you do what you do.
Sure. Hi, my name is Yael Rothman, and I'm here on the line with Katia Fredriksen, and we are pediatric neuropsychologists. Neuropsychology is a branch of psychology that looks at brain behavior relationships. So that's really what we specialize in. We both got degrees looking at clinical psychology. So we both have backgrounds as clinical psychologists. And then we went on to further our studies with fellowships that really focus on pediatric neuropsychology, which is understanding how a young person's brain works. We both do not do therapy, we do assessment. So young people will come to our office looking for answers to some questions. For example, why is school hard for me? Or why am I struggling socially? What's going on? Why can't I focus? Or why am I always procrastinating and struggling getting work done? And often these questions come from parents, school, other professionals, or from the young person themselves. So then we get to meet them and spend so much time with them, which is such a cool thing about our profession, is not many professionals get to be in a room with someone for like almost 7 hours to do these assessments across a few days. And we really get to know a child, an adolescent, and understand them and then create a plan of action. And then we talk to the child or adolescent, the parents, other providers, and help put this plan into place.
Amazing. So I would love to, you did touch on it there, but I would love to ask you, and then I'd love to hear from Katia as well, what the difference is between sort of the standard psychologist and a neuropsychologist.
Well, so it's to do with the final part of the training. So we have done, there's a lot of there's always drama within each and every field, right? And so there's sort of, as is the same for our field, there's drama about, what is a neuropsychologist, who gets to make that definition. Most people, I think, would agree that it means that you've done 2 years of postdoctoral fellowship focused on this particular branch of psychology. And the difference is, so if you think about it, so we've got social workers teach or do therapy, right? Psychologists teach or do therapy.
And this is in the United States. I wonder if it's a little bit different in internationally. Yes, yeah.
Sorry. For reference. Yeah, I find myself explaining this to friends a lot because they'll say, oh, you're a psychiatrist. No, not quite. So in the US, psychologists teach or do therapy, work in schools, etc., and can do sort of more abbreviated assessments that look at psychiatric sort of functioning and cognitive functioning. Neuropsychologists, it's that extra step where the evaluation is more sort of just comprehensive, looking at a wider range of domains of functioning. We can sort of look at more potential diagnoses and offer sort of bit wider ranging findings. And then psychiatry are the people with medical degrees who are therapy and or medication.
The majority of the clients that we see do have more developmental differences, learning differences, social differences, thinking differences. But neuropsychologists often see medical populations as well, and we do a variety of genetic differences or epilepsy or other medical conditions as well.
Thank you so much for explaining that, because I think it's really good for people to understand, because I think there is some confusion in our parents get sort of thrown into the deep end, and, they don't know the difference between a psychiatrist, a psychologist, a coach, and, all of these things. They all have different purposes, and, it's really great for people to be able to invest their money wisely with what they need at that time. And that can change,
And different purposes and different training. And it's, as you say, there are so many people out there. And it's really important to know you're investing your time and your money in the right professional for you or your child.
Exactly. So now I would love for you guys to tell me a little bit about the diagnostic process, because you guys, you're great at that field. Can you tell me a little bit about why you think it's important for children to learn about their diagnosis? Because this is a conflicting one for a lot of parents. How do we tell our kids? How do we communicate this? Yeah.
That is a big piece that we think is important as part of our assessment. And it wasn't always this way in our field. Our field began really telling parents about, or caregivers, about their child's profile. And then they kind of led the charge of putting things into place. And what happened is maybe sometimes these young people wouldn't hear about their diagnoses until much later in life. And that would cause stress, anxiety, identity crises sometimes, thinking, hey, I knew something was going on, but no one ever shared that with me. And that's unfair. Why did I miss this part of who I was? We really think it's important, it not only to build understanding of how they think and learn, but to also challenge any misconceptions that often come up. We've had young kids come to us saying, I'm stupid. I'll never be as good as somebody. I'll never be like the other kids in my class. When really we can correct that and say, guess what? You think differently. You have these beautiful strengths, and we know how to support the areas that are challenging for you. We also think it helps build self-advocacy skills, because now a young person knows, here's what works for me, and can ask for it. And that's really our goal ultimately in their life, is that they will ask for the things that they need and they require. So we want kids to understand that being a different thinker is a beautiful thing. And we'll talk about that, I think, in a little bit. And also know the things that are hard, and how do we support the things that are hard for us? Because we all have things that are strengths and things that are challenges.
I think that's, I agree with that 100%, because I sometimes work with parents and they'll say, oh, I don't want to give my child a label. I don't do labels. And I say, it's been my experience that these kids give themselves labels, and they're a lot worse than the labels that, that the doctors give them. They tell themselves they're lazy, and it's awful. It's awful, the words that they can tell themselves about what's going on in their brain. But once they know, there's power in that. There's power to knowing how your brain works.
Absolutely, yeah. And to sharing that knowledge, where appropriate, with family members, school staff, etc., so that everyone has the most accurate and sort of essentially kindest view of the child's profile.
Yes, yes.
It is definitely one of the most common things a parent says to us as well. We share that experience about the idea of labels, and I often will talk about how negative labels are happening even if we don't replace them. They're taking place. Yes.
I'd love to extend that out. Katia, you mentioned just then about informing family members. And, there's always some uncle at the barbecue who's got some strong opinion about ADHD, right? They didn't have that in my day and that child needs discipline and blah, 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 blah. All that noise that goes along with ADHD. Do you have any, great ways that you can suggest that we kindly inform that perhaps the uncle at the barbecue that's got some strong opinions about it? How do we handle those people?
That's such a good example. I just have this vision of this obnoxious uncle at the barbecue with sort of strong, outdated opinions. I mean, stepping back, I think we need to sort of consider the fact that some people we can talk to are blue in the face in as reasonable and data-driven a manner as possible. And, we won't scratch the surface. Right. And so we need to, not that we won't try, but we also need to sort of acknowledge that we're not going to be able to bring everyone up to date in regard to sort of what the current thinking is. That said, I mean, we'll do our best, obviously, because we want to stand up for our child and educate people who are important to them in their lives. And so, I mean, I would say to the uncle that I don't know exactly how old this putative uncle is, but times have changed. I mean, we know a lot more now than we did when you, sir, were a child. And, we know a lot that helps us really treat people in a more appropriate manner, right? I mean, we can all think back to just how little we knew. And I'm assuming, just how little we knew when we were children, just in terms of the exposure that there was to different sorts of diagnoses. So one reason why we're seeing more ADHD diagnosis now is just that there is better sort of coverage and exposure and information out there. It's more accessible. We have the internet. We have, all these sorts of things that when we were growing up, and Sharon, you may be younger than I am, but when I was growing up, there was, those things weren't there. And so you didn't have that sort of information at your fingertips, right? So one thing is that there is greater accessibility. And the second thing I think is that we have gotten better at identifying the less obvious cases, right? So I think people have always been good at noticing something that's noticeably different, right? As to whether they've been accurate in labeling it is another question. But we've gotten better at noticing the less overt cases that are nonetheless clinically significant and having a major impact on the person's life. And so I think that's another aspect as well. Why, we see increase in diagnosis rates over time.
Would you say, because there's a lot of buzz in the media at the moment in Australia about ADHD being overdiagnosed, right? Do you think it is overdiagnosed in children?
I mean, it's an interesting question. My opinion is that it's not significantly overdiagnosed. That said, that one needs to proceed with a lot of caution, as with any diagnosis. But ADHD, for example, in this case, we need to be very careful that we are holding a child to appropriate developmental expectations, right? So especially with younger kids, that's not to say that it may not be an appropriate diagnosis, but you really need to proceed with caution and just cross your T's and dot your I's diagnostically. And so I think sometimes, I think the other issue too is that the term gets sort of thrown around in an informal manner, right? Like, oh, I forgot my keys. Oh, I must have ADHD. You know what I mean? And so it's just like a lot of psychological terms, it just gets thrown around in this informal manner. And so then, there's this perception that it's everywhere, when in fact it's not the case. Is there anything you want to add, Yael?
As evidence-based providers, we definitely stick to the criteria and know that people in our area and in our who diagnose also are really following the protocol. But I'm sure there are professionals who are out there that may not choose to look at clinical significance for a diagnosis of ADHD, this many symptoms over multiple settings, et cetera, that they're looking for. But once you do stick to that criteria, I think that the accurate diagnoses are happening. We're a little skewed because people come to us because of these challenges. So it might look like we have a very high rate of ADHD diagnosis in our office, but that's actually the kids that are coming to our office. So it's our clinical population is very different than the typical population.
I do find it interesting when I have the opportunity to go into my children's classes and just sort of think, this is the normative sort of array of of children of this age.
I thought you were going to say you were diagnosing people in the classroom.
Well, possibly there may be some thoughts that go on in my brain while I'm in there. But in general, I just enjoy that opportunity to just look at, wow, this is not a bunch of people presenting for, a clinical evaluation. It's so interesting. It's a good sort of grounding experience,
Yeah. Well, in Australia at the moment, I mean, the official stats are that 2 kids in every classroom. But I would challenge it to say that it's a lot higher than that.
Yeah, it's probably more.
Exactly. Yeah. I would say that some kids are doing a good job masking and perhaps some are which diagnoses, and the wait times are long here, and people are having a lot of trouble getting support. Which it's always great to be able to connect with professionals like you, because any tips that you can give parents as they're waiting or perhaps as they're going through this journey is really helpful. So what do you think, if you were to give like one piece of advice, both of you, to a parent who is looking at perhaps at their child and thinking it's time to go and see a neuropsychologist or a developmental pediatrician and get this ball rolling? What is the one thing that they can do you think, that would help them along this road?
You mean in terms of getting in to see the person, or in terms of starting to support the child while they're waiting?
I think supporting the child while they're waiting. I think unless any doctors are open to bribes to getting in, I think it's very hard.
What I was going to say was, in regard to that first point, not so much bribes, but just what I do say to family and friends and, clients when appropriate is, if there is a very long wait to get the sort of evaluation that we offer, or that you can access via a developmental pediatrician who has that extra specialization, I do recommend starting via your regular pediatrician. And so I don't know if there's any distinction in terms of how we can do that in the US versus Australia. But so, for example, you can go and consult with your pediatrician here, and the pediatrician will give you standardized questionnaires that you will fill in and that you will ask teachers to fill in, and then they will use that data to decide on a diagnosis, and you can proceed with treatment. And you could do that while waiting, for example, to get a more thorough evaluation if you wanted to sort of get the ball rolling because you felt that time was wasting or that your child was suffering, those are the sorts of things I might think about, because it's much easier to get in for a consult with your pediatrician, right, than to wait for the eval.
I wonder about also talking with school and having some consultations there as well. Here, schools would be open to discussing things even without a diagnosis, starting to just say how things are going in the classroom, and then think about accommodations that could be supportive. Maybe your child is coming home saying, I'm losing focus by the end of the day. Is there something we can do to help with their seating in the classroom so they can be more less distracted as the day goes on? Can we repeat instructions? Can instructions be written down? Do you think, as a parent, instead of giving verbal instructions, maybe you want to start writing things down so that you can support their attention and working memory that way? So we can give a few tips along those lines as well, even without a diagnosis, how to just support the best attention and focus that you can have.
Yes, that's excellent. That's really good.
And this is a little self-promotion as well, but maybe for parents may want to look at the book with their children that we just wrote, this Different Thinkers ADHD, which talks about a different thinking brain, some ideas of how it can present ADHD, different males, females, etc., and ideas of what you can do as you go into the classroom, at home, visual checklists, things like that we put in here as well.
So tell me about, and I'm going to put a link to the book in the show notes as well for everyone. Tell me about the motivation behind writing the book. What made you guys go, we're going to write a book together?
Well, this was a COVID creation for us. This was something born of that era when, so much of the world shut down and we were mentally sort of looking for things to keep our finger in the, what's the expression? You know what I mean? Like keeping your toe in the water kind of thing, right? To keep our brains sort of functional. And I will say that Yael was more of the mover and the shaker in terms of sort of getting us going. But yeah, I mean, it sort of directs back to that idea of what Yael was speaking about earlier in terms of just the importance of presenting diagnosis to children in a developmentally appropriate manner. And we like the idea of something that could be referred back to, like a tangible object that the child could have and refer to as needed. And so we looked around and we saw that most of the books that we found out in the market were more focused on specific sort of characteristics or issues or symptoms or whatever you want to call them. For example, so-and-so struggles with speaking out of turn or personal space or whatever it is. And so the narrative would be about so-and-so's experience with that and sort of strategies that were put in place to help and happy ending, etc. Right. But there wasn't, and not that there's certainly a place for that, not to say there isn't, but we didn't see much that necessarily presented the diagnosis as a whole, using the terminology and explaining sort of the neurological aspect and presenting sort of the different ways in which the diagnosis could manifest in different people, right? And so that was sort of where this came from. And we would sit up on Zoom like at night and write things together. And I mean, I know it doesn't sound like much fun, but actually, I think it was really like a lifeline in those times, right?
I think it was a lot of fun. We're looking for resources for our clients. That was something that we wanted. And so we couldn't find it, so we created it. And it was a lot of fun to do and so exciting to see it come now in the flesh.
So to speak, right?
Yeah.
Yeah.
I always think that the best resources come out of that sort of need. Like when you can't find what you want and you create it. Like that's what the functional family was all about. Like my business is, we were looking for support for the whole family. We couldn't find it. And so we created it because you see the need. And so you can see where the gap is. And we get a lot of posts in our support group. I've got a support group with about 12,000 people in it and saying, I want a book to explain ADHD to my child. Like they want this resource.
Good. Well, that's so encouraging to hear. We've had some really nice positive feedback from colleagues and friends, and it's just so much fun to see it come out and actually, to read it, reading it with my own kids. And it's been a lot of fun to watch the sort of the evolution.
Amazing. Well, I'm very, very excited to see it. I want to talk about girls for a minute because it's like, we know that girls often get missed in the diagnostic process. They don't get sent for the assessments in the beginning. They're great at masking sometimes. I mean, everything's a generalization here. But can you tell me, why is ADHD getting missed in girls?
It harkens back to the conversation about the uncle at the barbecue, right? In terms of us becoming more, the diagnosis becoming more nuanced, us becoming more competent in detecting it in a more subtle presentation. And so again, as you say, it's not always the case. But this idea that girls with ADHD present differently than boys with ADHD, while not always the case, does come about for a reason, because we do often see it. And so again, not always, but typical, more sort of female presentation is more subtle, less overt, less noticeable. I mean, when you think of a child, sort of an elementary school age child with ADHD, you tend to think more about the H part, right? You tend to think about that fidgety and the impulsive element, sort of the kid who's sort of fidgeting in their seat and can't sit still, and they're poking other kids and speaking out of turn. And these are very sort of obvious behaviors that, of course, teachers will pick up on, pretty darn quickly because it's disruptive to the classroom, right? And so those are the sorts of things that are more, again, common overall in boys with ADHD. And so when the diagnosis was developed, those things were emphasized because, like so many other things in the medical field, the research was mostly done on boys and men, right? And so we learned more about how the diagnosis presented in that population. And then as we advanced, this became sort of a broader population that was studied, and we learned more about girls. And again, on average, we see your girl with ADHD is more likely to be a bit more the attention element, the sort of the more inattentive, daydreamy, out to lunch kind of thing, which is just less noticeable. So in the context of a larger classroom, thinking about maybe a girl who's sitting in the corner looking out the window and not listening, she's less likely to be noticed than the boy who's like poking the other kids and won't sit still, right? And so she's less likely to be caught. And so, I mean, in terms of diagnosis. And so oftentimes, it's more common, I think, in females to be diagnosed at a later age. And so we'll see kids who are, sort of teenagers. Plenty of adults are diagnosed for the first time. Plenty of female adults are diagnosed for the first time with ADHD, not until they're, I met a woman the other day who's brought her daughter in for evaluation because she recently was diagnosed in her 40s. And so she's like, oh, I recognize a lot of these traits in my kid. Why don't we take a look at her as well? And so, and so that's sort of my thought process there. And it's why you just have to be so careful and look at the subtle markers.
Yeah, it can be quite different, can't it? And as you said, we all think of, or what we all used to think of ADHD is that hyperactive boy in the classroom, and there is a lot of conversation about women in general presenting as more as anxiety. It presents as anxiety, and so they're getting diagnosed or perhaps on medication for anxiety, but the real underlying cause is ADHD, undiagnosed ADHD. Are you seeing that?
That's a very common presentation. Yeah, we definitely see that in our office when a young female early on, maybe, I'm missing the instructions because I'm worried about missing the instructions versus or I'm so anxious about the test that I rush through it, or whatever it might be. And that is what pops into everyone's head. Oh, this is an anxious child. We need to support this anxious female. And then we see them around middle school, maybe high school. And then you realize the executive demands have just skyrocketed. And then you start to see all the challenges with studying, procrastinating, and the issues with attention start becoming more apparent there. Not saying that anxiety and ADHD are not comorbid and don't overlap. We definitely see individuals who have both of these diagnoses, but it's a very common presentation in our office to see that.
I always think of it too as a bidirectional pathway, where attention problems have emotional implications because, like you said, I zoned out. Now I've zoned back in and I'm in a panic because I missed whatever happened, right? And then anxiety has cognitive implications because, you're sitting there sort of ruminating about what you're anxious about, and it's causing you to experience inattention. So they really do cause one another and very often co-occur. So it's not at all uncommon that we would see that presentation all together at once. And then you sort of think about, in terms of recommendations and treatment, do they both need to be treated? Will one be treated and then it will help the other one secondarily? That sort of thing.
Now, I would love to ask you about hormonal changes and puberty and things. Since you work in this age group, how much does that have an impact on ADHD symptoms?
Well, that's an interesting point. I think the main way that I think about adolescence and ADHD, I guess I think less about the hormonal shifts per se, and I think about the sort of the increased risks that we worry about with adolescents and how amplified those are in adolescents with ADHD, particularly those who are not medicated. That's sort of the way that when I think about adolescents and ADHD, that's really what pops mostly into my head. I do think that just thinking about what you're talking about in terms of that that causal pathway between the attention and the emotional implications. If you think about the hormonal effects on the emotion, and again, especially in girls, right, this idea that girls are at higher risk for anxiety and depressed mood in adolescence, and you could see that being amplified in somebody who has that risk factor already as a result of the ADHD.
I would say it has this natural map onto, as you get older, what you're required to do is so much more. You're, at least in the States, when you enter middle school, so this is your age 11-ish, that suddenly you have multiple teachers, multiple classes, you start getting more homework. These are all things that did not happen in elementary school, and now you're becoming an adolescent, so it's mapping on exactly into this hormonal change as well. But really, you've always had these challenges. You're now being pushed to a point where you can't keep up because of all the things that are happening. And again, that happens the shift to high school around the age of 14. Now you're almost expected to be independent at this place. And these young people are not able, their prefrontal cortex is not developed at the same rate, and they're not able to keep up with these demands.
Thank you so much. I want to, if you guys can please leave us with one really clear practical strategy that parents can do with their beautiful children to help support them. I always love to have something to take away that parents can try. Maybe it's something that's in your practices that you tend to prescribe a lot in terms of strategies. Something that's quite common that hits the nail on the head. I'd love you to share that with our beautiful audience.
Well, I have two thoughts. I know you said one, but
I'll go for it.
I'm a rule breaker. So my first thought is more in terms of the self-care of the parent, right? So this is to do more with the parent's thought process. I mean, I have plenty of ideas, and I'm sure we'll talk about a little bit more about this, but for practical recommendations. But the thought process is so important, I think, in terms of your tolerance and your ability to just manage the frustration. Because there are frustrations inherent in this when you have to tell someone to do something 10 times when you feel like they should have done it the one time, or when it's like always the clothes are all over the floor instead of in the hamper. These things are frustrating for all of us. I mean, no matter how evolved and enlightened and nice people we are, it's just frustrating. And so the philosophical thought process that I'm referring to is the whole can't do versus won't do sort of way of thinking about things. And I'm a believer that children are going to generally be trying to do their best because they want to please us and they want to do well. They're not trying, every now and then they're pushing our buttons because that's how human beings are. But in general, right, they want to do well, they want to please us. And so if they're persistently doing something that they can see as annoying to us, they're not choosing to do that thing, right? And so again, this idea of, so certain things are harder for your child with ADHD. You may say, oh, well, your younger sibling can do X, Y, Z. Why can't you do it? Or you're X years old and you should be able to. This whole should sort of way of thinking is just not productive because it's just not fair on the child, and it's not fair on us because then we sort of get upset about things that we don't need to get upset about, right? And so I try to remind myself of those sorts of things, because it's a marathon, as they say, not to be entirely cheesy. And so you need to really sort of be trying to take care of yourself, and not getting unnecessarily frustrated and upset helps in that regard. So that's one thing I would think about. And it may not be a practical tip per se, but it's more of a mindset, or taking that pause before you sort of get frustrated. And, well, is so-and-so doing this to piss me off? Or is so-and-so, this is harder for them. And I think that's an important pause to take before we react.
I think that's a very practical tip, is managing your expectations.
Thank you. Yes, that's a good way to put it. I was thinking sort of visual schedules and sort of practical things like that. But
but to understand how your child thinks and learns is probably the biggest tip of all. Yeah,
true. Good point. Thank you. Pat myself on the
You
back.
said you had a second one, though. I didn't mean to interrupt. Yeah.
Oh, well, no, then I was going to give a more just down to earth practical thing. And that's just the idea. And if I'm stomping on everything you wanted to say, Yael, then I'm sorry. But it's just the idea of breaking things down, right? Again, cycling back to that idea of you're X years old, you should be able to do blah. right? Well, guess what? So-and-so can't do whatever this thing is yet. And so let's break down the task. It's not like go clean your room, which is, it seems to us like, oh, it's basic, I expect to come in and the bed's made and the floor is clean and, I'll be back in 10 minutes and see how you've done kind of thing. That's not productive because that is an overwhelming task when you think about all the steps involved. So again, just this idea of breaking down multi-step tasks. And so, okay, let's make a list of the steps that need to be taken. Let's write them all down. Let's stick them on your wall. And then when next time you say, go clean your room, you say, go clean your room, check out the list on the wall, follow those steps. You're going to pick up your things from the floor, you're going to put your books on the shelf, et cetera, et cetera, et cetera. And that makes it more manageable and a more successful experience for everyone, because then the child is more likely to be successful at their task you've assigned, and then you are more likely to get them positive feedback. Because the fact of the matter is that kids with ADHD get so much more negative feedback than the average child, and it's sad, and we have to remember that and sort of really try to lay on those positives when we can.
I think that sounds great. I definitely want parents to be kind to themselves. I think one of our big tips is self-care of a parent so they can be there for their child as well. So the same thing that Katia was just talking about managing expectations and understanding. Maybe you say this a lot too, but on the airplane where you put your own oxygen mask on first, right, before putting someone else's on. That's what you have to do to parent your neurodiverse child. And it's important that you're present and available and can care for yourself. And then you're going to be less likely to be frustrated in these moments, more present, more understanding. So I think just kind of getting onto the same tip that you provided, I would say that as well.
I'd love to add too, and it was such beautiful tips and great ones to share with the audience, is that no one's perfect at this parenting game. Like, we stuff up spectacularly here, and like
it's mortifying how often we do.
Well, I'm pretty no, okay.
I tell you, like, I literally do this for a living all day, every day, and still stuff up spectacularly. But what we are good at, and what I love to share with parents, is the repair bit. Like, that it's okay to go like, guys, I didn't handle that how I wanted to. I am so sorry that I just lost it back there. I'm going to try next time and do this XYZ, like it's okay to do the repair, because our kids with ADHD stuff up spectacularly all the time too. And I want them to learn how to do the repair.
I would say not only is it okay, it's important. Like, that's how everybody learns from each other. I think that's beautiful.
Yes. And I think we just also, as we're doing the repair, exactly as you said, Sharon, like I messed up. I'll try to do better next time. Not I messed up because you did right? That's the backhanded compliment of apologies. Do you know what I mean? So we have to be so careful in our wording and truly accept responsibility.
Yeah, I think that's a very, very good reminder. And, it's so easy to be hard on ourselves about, what we're not doing right. But what about all the things that we are doing right? Like, this is a tough marathon. Like, as you said, it's not a sprint, and it's not for the faint of heart, like it can be tough out there. So that's why I love that you guys have written a book to help explain how our beautiful kids' brains works to our kids, because the more information and practical tools we have, the better. The more everyone understands about ADHD, the better.
Absolutely.
Thank you. I think we aimed for that. And I completely agree. Parents can be so hard on themselves. I hear it all the time from my friends. Oh, mom fail is what they share with me. Here's what I did. It's just to be kinder to ourselves. And there are so many great things that are happening too.
Amazing. Thank you so much for your time today, ladies. I've enjoyed our chat so much.
Thank you.
Likewise. Thank you for having us.
Thank you for listening to this episode of the ADHD Families Podcast. If you loved it, please share it on your socials. I want this to start a conversation about ADHD. If you want to make this mum do a little happy dance, please leave a review on iTunes. If you would like to know more about what we do, check out thefunctionalfamily.com. I truly hope that you enjoyed this podcast and you use it to create a wonderful, effective, joyful life with your beautiful children.